Hi everyone, my name is Cheryl Baltazar. I'm a movement disorders nurse practitioner, and my goal is to help in between your neurology visits. I understand that we don't have a lot of time to see patients in the clinic, and that usually gives us less time for discussion or questions about day-to-day struggles. Just disclaimer, I wanted to make sure that this discussion does not replace the advice of your doctor. This is not a medical advice. This is for educational purpose only. And if you have any specific question regarding your case, you should reach out to your treating neurologist. I wanted to talk about the importance of taking the medication on time for Parkinson's disease. The most common drug that we use is carbidopa-levodopa. This will be the most effective among the available options that we have as far as medications. And typically we will start this about twice or 3 times a day. A lot of times we would start it 3 times a day to get a good coverage for your symptoms during the day. And what I see is that there's a misconception that this medication has to be taken similar way to the other medications that we will take 3 times a day. So usually we will divide it into every 8 hours. So that's every 8 hours, 3 times a day. Take it in the morning, take it around the afternoon, and then at bedtime. Now, this medication, carbidopa-levodopa, does not work the same way like that. This medication, remember, is for your symptoms. So you want to take the medication during the day when you're awake, your wakeful hours, for you to be able to get coverage for your tremors, for your walking, for the slowness, for the stiffness. You don't take it at bedtime unless this is specifically targeting the nighttime movements or nighttime symptoms or early morning symptoms. Now that's a separate discussion that we can have later on. But usually we want to do it around every 5 or 6 hours apart. Sometimes you will have to do it every 4 hours depending on how it works out in your daytime activities. And in this way, you have a continued dopamine level during the day when you're moving around. So this is also going to be helpful in avoiding motor fluctuations, which means that if you're someone who would experience symptoms of Parkinson's more prominent before the dose of your next medication, then we would call that fluctuations. Your movements, your symptoms fluctuate. You go up, you go down. So the level of the medication go up and go down. So the goal of this medication is for you to feel leveled. Your symptoms are not going up and down. So the best way usually is to optimize the timing between the doses. You don't want to take it too far apart from each other. This can also improve dyskinesia. If you optimize the timing of the medication, you would usually avoid having other involuntary movements, just like swaying or big jerky movements. Those are sometimes you can see when you are taking the medication too close together, or very occasionally they can also appear when the medication is wearing off from your system. So I think it's very important to optimize the timing of your medication. Does not have to be taking it the same time every day, but the more important thing is that you follow the same interval between the medication throughout the day, so that even if you wake up late, you still follow the same amount of time in between the medications. If you go and travel abroad and they have different hours, you just follow the time, when was the last time you took it, and follow the interval that you usually do for the daytime. If you have any questions, you can reach out, but remember that this will not replace the discussion with your neurologist. But I hope this is helpful, and we'll see you next time for other discussion. Bye-bye.